My name is Pamela Kunz, and I'm an associate professor of medicine in the Division of Oncology at Yale School of Medicine, where I also serve as the director of the Center for GI Cancers and the vice chief of diversity, equity, and inclusion for medical oncology. Today, I want to share a message of inclusion and equity for women in medicine as we celebrate International Women's Day and this year's theme, Break the Bias. We are also in the midst of Women's History Month, and we honor female pioneers in medical research, education, and practice, such as Rebecca Lee Crumpler, who was the first African-American woman to obtain an MD in 1873. Her publication, Book of Medical Discourses, was one of the first medical publications by an African-American author. And in 1990, Dr. Antonia Novello became the first female Surgeon General of the United States. Since then, there have been 2 other women to occupy this position. Now for some statistics. In 2003, 50% of all medical school applicants were women. This number has doubled since the 1970s. By 2007, 48% of all medical school graduates were women. And in 2018, there were more women applicants and graduates than men. And even the number of applicants of women of racial and ethnic minorities saw a slight increase. Despite these gains, we have more work to do. Even with more women graduating from medical schools, the number of women medical residents is still less than men. In 2018, 46% of medical residents were female and 54% were male. At present, only 36% of practicing physicians are female. And in academic medicine, women are increasingly underrepresented at each rank, and with only 18% of department chairs held by women. Gender bias, salary gaps, gender harassment all contribute to this drop-off, while family work conflict continues to be a challenge for the new generation of women. There's work to be done by everyone, men and women alike. So I ask you, what can you do to support and promote gender equity in medicine? I encourage you to look through this lens of equity in everything that you do. Let's make it our job to invite all voices to the table and create an inclusive culture where it's encouraged to speak out. Be aware that we all have unconscious biases around gender, race, ethnicity, age, and do our best to minimize them. And we should all work towards solutions. So please join me in crossing your arms as a show of solidarity, and let's break the bias together. Thank you.